Thank you. Thanks for having me.
So the last time you were here, we were in the midst of the COVID pandemic. Vaccines were just being created. We were not yet seeing the light at the end of the tunnel. Here we are now. We're in June 2021. Things have opened up. The biggest cities in America, New York City, Los Angeles, people are going without masks. What is the status of COVID in America? It's a big question, but I know you're the right person to ask.
Right. So, there's a lot of good news all around, a lot of optimism, especially, in the New York tri-state area, but across America. And it's all very good news. It's all very much a result of vaccinations because, there's a clear delineation in the timeline. As more and more Americans have gotten vaccinated, we've come out of the woods, as they say, but it's not completely over yet, and I want to give people a realistic view of things because much of the globe is still not vaccinated, right? And in the same way the pandemic ended up here from overseas, we still are at risk of a variant showing up that our vaccines are not as efficacious against. The Delta variant, which everyone has been talking about recently on the news, it is the main strain now in the UK and likely will be here in the US. And as of now, the vaccines are working against it. But again, we still need everyone to get those vaccinations, including children. And we have to be vigilant because, again, that variant is more contagious and can be more infectious than previous ones.
And in terms of the Delta variant, what you said is it's in the UK now, most likely will get here in the United States, just by the borders being open, people traveling. With vaccinations, whether you had any of the three available, would that protect, or we just don't know yet with that variant?
So it looks like it would protect. So this variant already is being tested against these vaccines. So it is still protective. So it's still in everyone's best interest to get vaccinated. And to be honest, it is already here, already in the tri-state area, we're seeing cases rising closer to 10%. And Dr. Fauci this morning said all new cases in unvaccinated people, even in the US, are the Delta variant. So it's here already. And the vaccinations are working against it. But in New York, 70% of people have had at least one shot. So we need to make sure all of those people get their second shot and don't let their guard down because, people can get sick while they're on their way to that full vaccinated status, because we know, it takes a few weeks even after the second vaccine. So that's why I'm saying we should still be careful despite all of the great news, which I'm celebrating in as well.
So I have friends, I'm sure you have friends who are anti-vaccine, who say, I don't want to be sick. I've heard people get fevers and chills and their arms hurt, and I don't believe in a vaccine. And if everyone else is getting vaccinated, then why do I? What would be a doctor's argument to that point?
Right. So my argument would be that currently the people that we're seeing in the hospitals are for majority unvaccinated. The people that we're seeing dying, there's still people dying of COVID every day, even though it seems like it's over. People are still being admitted, people are still dying. And all of those people, or the majority of those people, are unvaccinated. So if you're vaccinated, you are at a much better risk of protecting yourself and your own health because you're much more likely to get sick if you're not. Even despite the low infection rates we have now, people are still dying, and that's because they haven't been vaccinated. So that's the first thing I would say. And then the second thing I would say regarding the side effects of the vaccine, they're so short-lived and limited compared to the actual virus. Like, I'm seeing so many patients that are still struggling a year later, 15 months later, and their lives are completely changed. And these are very healthy, active people. And then even if they made it out and didn't, God forbid, die from the virus, they have so many problems now. They can't work, they can't, take care of their children or their parents. So it's, I would take the 24, 36 hours of side effects from the vaccine trade-off to what I'm seeing in the people who actually had the virus.
Mm-hmm. Yeah, the risk versus reward there.
Yes.
Mask wearing. That's been kind of a toss up. Some people I still see people wearing their mask driving, which I still don't get if they're just the only passenger. Um, but here nor there. But mask wearing, what is your recommendation on that? Should you be wearing your mask even if you're vaccinated in public settings, grocery stores, before you sit down in a restaurant?
Yeah, that's a great question. One also I'm getting frequently. So the good news is we found out that outdoors, the risk of transmission is relatively low. So if you're outside and vaccinated, likely you don't have to wear a mask unless you're in a very like packed place, like let's say a concert or something where you can't really socially distance yourself from the person next to you. But in public settings, I still advocate for wearing a mask. I still wear a mask when I go into stores, when I'm on public transportation. Basically, when I'm anywhere inside where I don't know the vaccination status of the people around me, I'll still wear a mask. In healthcare settings, obviously, it's still recommended. So for all of those reasons, yes. Now, these are just guidelines, the mask guidelines. So you have to tailor them to you. And that's what I tell my own patients. So if you're someone that's high risk because your immune system is compromised or you're on certain medications that make you high risk, or you're a certain age that makes you high risk, and by all means, keep wearing the mask if you want. You at the end of the day, you're only protecting yourself. So again, these are all guidelines that have to be tailored to each individual. So someone without those risk factors may go mask free more so than someone who is elderly and also has an immune system issue.
Now, children,
Mhm.
they're still vulnerable, even though, right, there's a lower rate of COVID among children. I have a child now who's in preschool. They no longer wear masks. They're not vaccinated. Where does the risk lie there?
Yeah, children, unfortunately, were really ignored throughout most of this pandemic. And in some ways, I understand why they weren't as affected early on. But now we are seeing that they're not completely immune. So 1 in 5 actual COVID cases are in the pediatric population. So they are still getting infected. And luckily, even if they don't get very sick, they still have the ability to transmit it to others. But that being said, we have had 400 pediatric deaths from COVID-19. We've had thousands of admissions, actually, not only just the hospital, but also to the intensive care unit. And it may not seem like a lot compared to the adults, but to me, even one child lost is tragic, right? Or
Oh
one
my
child
God.
in the ICU is heartbreaking. So I think we do need to protect our children, especially now as schools are opening up. They are still considered a vulnerable population. So in the US, age 12 and up does have that emergency use authorization. And I've been encouraging all my patients that are 12 and up to get vaccinated, all my, family, friends, kids. So they very much are part of the equation, and we can't keep leaving kids out from this.
At what point do you think that children under 12 could possibly get approved to be vaccinated?
Yeah, so those trials are going on now as we speak. So I think by fall or even winter, the latest, that they should have some type of indication, if not all the way down to infants, at least for, let's say, 6 and up, or younger. So hopefully, and I know that there's a lot of concerns about side effects in
Yes.
children, but especially with the 12 and up, there's been a lot on the news with heart inflammation being caused by the vaccine, something called myocarditis. But what people don't understand is that COVID-19 causes it in children and adults, that same heart inflammation, at a much, much higher rate. So ironically, by getting the shot, you're actually protecting your child from that heart inflammation. So people have to be careful, with what they hear, especially on the news, because make sure you're looking at the big picture. Like myocarditis is much more likely if your child gets COVID, the virus, or any other virus, than the vaccine.
Now, this is a question I've been discussing with my mom friends.
Mhm.
Birthday parties and gatherings at things like bounce houses that are indoors, kind of like playland jamborees. Some of my friends are having them, and I'm more cautious because I know the children don't have any protection. And even though, as you just discussed, they're not the highest population, they still have a vulnerability to COVID.
Right.
Do you think it's a little bit too premature to be doing kind of indoor parties like that with large groups of children?
Yeah, if children are unprotected, they're at risk, especially inside. Outside
Yeah.
is the safest. And it all depends how these indoor events are occurring. So, if it is in places where the kids can socially distance, if masks are being worn, although, it sounds doubtful, especially with a group of kids like running around, then,
Right.
there are, there
Kids don't socially distance. They don't. They're all over
exactly.
each other.
Yeah, exactly. So, I mean, as they say, the devil is in the details. So it depends how these indoor parties are happening. There are ways to do it safely, but for the most part, I know, human nature, it's hard to do it safely, especially with young kids. So I would first opt for outdoors. And then if you have to do indoors, you still have to take those measures because adults may feel free of the pandemic, but for kids, like you said, they're not protected yet. So I
Right.
think we still should protect them.
Another aspect of COVID that I think has largely been ignored at this point, at least in mainstream media at this point, you and I worked together a lot on pieces of what was going on in terms of psychological burnout for medical professionals that were on the front lines of COVID. Here we are now, as we said earlier, looking at the other side, that there's hope, there's restoring to what was our normal. But yet the impact, I think, psychologically hasn't just been relieved. It's still impacting those that were on the front lines. What have you heard, or not necessarily experienced, but what have you heard from those practitioners who felt the burnout from being on the front lines of COVID?
Right. The psychological burnout is very real. And I think it's really under recognized and underappreciated. So I'm really glad that you're bringing it up. So just to give you perspective, even before the pandemic started, burnout was already stressing our healthcare force. So there was one doctor suicide per day in this country pre-pandemic. And now post-pandemic, you can imagine already burnt out, stressed out workforce is even in worse condition. And we've seen an increase in suicides. I know at least 2 or 3 physicians that have killed themselves during this pandemic, emergency room physicians or other specialties. So it's very real. And I'm really worried actually that we were already in a bad shape before this pandemic started. And I think, unfortunately, it's going to be much worse. There's burnout, there's post-traumatic stress disorder, and I think it's going to last for years to come. And on top of that, this is a very unique time because one, healthcare professionals are always stressed out because we're caring for people's lives, and it's not a small thing. It's something that we carry home with us, that we think about all the time because you're dealing with people's lives, people's families. But this is the first time that we had to worry about ourselves and our own families in the same way as the people we were taking care of. So you can imagine how much stress that adds, right? So for many of my colleagues, it was scary to go to work, especially initially when they didn't have any PPE, no protection. And then they were worried about infecting their family, their friends. Many lived in isolation for the first few months. I wasn't working in the hospital, but even I didn't see my own parents, my husband, anyone for the first 3 months of the pandemic. So that takes a toll as well. And many had it, far worse than I did. So I'm sure you saw when healthcare workers were getting vaccinated, people were like weeping tears of joy because it was such a huge burden lifted off, so much relief. But even then, so that all of that mental stress I think is going to go on for a long time. And I hope that there's going to be resources pooled towards that. As of now, I haven't really seen anything yet, but I'm glad at least the awareness is being raised around it.
Yeah, well, thank you for sharing that, because I do think we can't forget the ones that were called heroes. We can't let them be without support.
Yeah, no, absolutely. And it goes beyond just, I know I was speaking of physicians because I am one, but the entire healthcare team, took on that stress. So nurses, physician assistants, nurse practitioner, everybody, even the custodial. Yeah, exactly.
Custodial
they were key. Yeah.
Yeah.
So they also took on that same stress, and they also had that same risk that they were putting on themselves and their family and their loved ones. So I'm sure they are feeling a lot of the same mental anguish as well.
Well, hopefully we'll have another talk soon when we can talk about if they agree to start vaccinating children under 12. And also I'd love to just keep doing these check-ins because, until we are absolutely free of COVID, we're not free of COVID.
Right, right. Absolutely.
So thank you very much for joining us again. It was great to see you.
Oh, no problem. Thank you for having me.
Always.